Hello, everyone. I'm Dr. Patti Peeples with the People's Collaborative, and welcome to the next episode of Patti's People, sponsored by the Evidence Base. Today, we welcome Dr. Laura Pizzi, Chief Scientific Officer of ISPOR, and I'm delighted to have you as a guest today, Laura. Welcome.
Thank you, Patti. It's so great to be here today. Thanks for the invitation, and it's great to see you again.
You've had a long and venerable career in HEOR, and you've now taken on the important role of Chief Scientific Officer of ISPOR. The organization has really been undergoing a great number of changes in the last particularly couple of years with new leadership. What is the vision of ISPOR looking toward 2030, and help us understand the why behind where you're focusing?
Yeah, well, first of all, thank you, Patti. And I'm pleased that you said venerable, but I do want your listeners to know that I started off as a longtime member, just engaging in everyday kind of member activities for the networking and the scientific learning, like many of the folks out there who are listening. And so my trajectory has kind of increased through ISPOR. And I think that, and I hope that that's an inspiration for your listeners to get more involved. But getting back to your question about the strategy. So having been a long-term member, and Patti, you know this as well, being in HEOR a long time, what we've done really well in HEOR is we've done exceptionally well with cost and outcome assessment and the value measurement, integrating cost and outcomes together to look at cost effectiveness. We've come a long way in establishing the methods there. We've come a long way in those methods being used internationally, through health technology assessment and through payer decisions. However, we have not done such a great job at thinking broadly in these kinds of assessments. We tend to have stayed in a very narrow lane where we're looking, let's say, at the direct costs, such as the healthcare costs, the prescription drug costs, pharmaceutical costs, lab costs, et cetera. So those direct costs are so common. And the outcomes we focused on largely are those which maybe are available at the time that assessment's done, such as clinical outcomes that were used for regulatory approval. And so that's not to say that what we've done is bad. We've made so much progress. But where the world is going is that we need a broader view of value, a broader view of health and well-being that informs the value of medical innovation. And we also need to understand that the healthcare decisions today are happening in very constrained resource environments. There are global labor shortages. There are delays in access to innovation because of budget limitations. So there are very real implications of the context in which healthcare decisions are being made. And so understanding that context is really important to making sure that the evidence that we're generating in HEOR actually will be useful to inform the decision.
So you've mentioned thinking broadly and thinking about the context. Give me some specifics on this. What audiences are you considering thinking more broadly about? Are they ready to receive this kind of information? Are they asking it, or is it going to be more of a push strategy? And what context do we need to be considering that we have not yet?
Sure. So the main theme that we're including this under at our strategic plan is called whole health. Whole health was identified by the board of directors and ISPOR leaders as basically a more holistic view of health and well-being, from which we should be expanding our views on value. Now, that term is not very well understood outside of North America. There's some great literature defining it. We'll have a series of commentaries coming out this spring, late this spring. We're anticipating May or June in Value and Health to help define what it is and how it relates to HEOR. And I would say that the reactions to it are generally favorable. Of course, there are some folks who are really sort of immersed in their worlds, doing HEOR assessments, who are sort of still questioning why, what does this all mean for me? But in general, as we take this whole health theme out and we talk to global healthcare decision makers, let's say at the payer level or at the government policy level, it's a resounding wow. Like, wow, I've been waiting for ISPOR to do this for a long time. Just as an example, last week we had our first kickoff call for the RWE summit that we're planning for Tokyo for September. And so we had some global leaders from different countries in the Asia Pacific region, and we went through the strategic plan, and they said, finally, we have been waiting for ISPOR to go there, with expanding its impact and also along with that, the science of measuring value.
Mhm.
What does it mean for us tactically? Because, it's not to say that our methods are insufficient or bad. What I see is we have to view this as we're not trying to boil the ocean and like try to encompass all that whole health is in our value assessments.
Mhm.
But yet there are certain cases where we're looking at, let's say, a treatment or program and we're trying to measure its value. And it's so obviously clear that the benefits it exerts are outside of the healthcare system. For example, I always think of children with attention deficit hyperactivity disorder. And, if I were a parent who had a child with this disease, I would want to know about their academic progression, which would be from the education system. If I was a caregiver whose loved one was afflicted with Alzheimer's disease, I would want to know, like, what are the impacts on me as the caregiver and also kind of the social community supports. So there's very clear instances of where when we start to think more holistically about the benefits of innovation, that those benefits oftentimes they're kind of more important or more obvious in
Mhm.
sectors outside of healthcare. And
Mhm.
so what I think this means for HEOR is kind of on a case by case basis, understanding, where does the value of that treatment lie, and at least opening our perspective to think that it may be outside of healthcare. And then can we bring in data, to inform that? Today we're thinking about value assessments that maybe take months to complete. I mean, that's at the point at which you already have accumulated evidence from like an R&D process and body of literature to kind of inform that value assessment. But the value assessments of tomorrow may very well be done in like 15 minutes with real world data that's at our fingertips.
Mhm.
And so, what will that real world data include? It's probably not just going to include healthcare data. It's
Mhm.
probably going to have the power of including data from other sectors that are linked. And,
Mhm.
and so we need to go there in HEOR. The healthcare decision making tomorrow will follow along with that data. The healthcare decision makers at the HTA and government level, in my view, are increasingly going to be asked about what the trade-offs are of investing in health versus other sectors. And so that's just another reason why, when you look at the way the data is going, you look at the way the healthcare decision making is going in the context of other government kind of priorities and considerations, that like HEOR actually needs to go there for us to continue actually to grow, I would say, our impact.
Is it your supposition that this particular focus will have an easier uptake in countries with government-sponsored healthcare? Or do you feel like the payers of healthcare here in the United States are ready to think beyond their typical cost impacts?
Yeah, well, naturally, where there's greater government oversight of healthcare decision making, this movement would resonate more readily. It's true that in the United States, because things are just so fragmented still with payers, that we're not ready. There are signals though when we start to look at things like Medicare drug price negotiation in the United States. Will Medicare only be looking at the implications on the healthcare sector or the implications even more so within the Medicare data set or Medicare proper? I think not. I mean, I have a feeling that, especially when you consider the growing influence of patients on what CMS does, that over time, and this isn't a tomorrow thing, but over time, I do believe that CMS will be under pressure to increase its view on value to ensure that it considers kind of these more broader, I'll call them holistic and more patient relevant endpoints. We're not there yet, but I do believe that's the direction we'll be heading.
Let's take a look at where some of the focus for Rob Abbott has been as the CEO of ISPOR. There has been a great increase in the involvement of policy discussions that I've seen for the leadership overall, including yourself. Tell me a little bit more about that. What policy, let's say, challenges is ISPOR directly taking on? What audiences are you speaking to and engaging with that is different than you were, let's say, 2 years ago?
Sure. So we have a policy goal in our new strategic plan 2030. We only have 2 goals in that plan. The first one is a scientific goal relating to leading the definition of and use of value in decision making, and the second is shaping healthcare policy worldwide. That's bold for us because we've always focused on the science side. Why do we need to go there with this new goal? Well, we need to go there because increasingly, the science is great, but increasingly there's guidance, there's policies that pertain to how the methods and the science are used in the generation and application of evidence. Mm-hmm. And so without having that policy apparatus, the science will hit a limit. It'll hit a limit in terms of the impact that it can have in actually influencing the evidence and ultimately patient care. Mm-hmm. So now we're not starting from ground zero on this. The Science and Health Policy Initiatives team that I lead, we're called Science and Health Policy because we actually do have some policy activities. Most notably, we do work globally with HTA authorities. We have regional HTA roundtables that are held. We've done it for, I think, over 10 years or so now. And they're really kind of orchestrated by HTA leaders in that region. Mm-hmm. And it helps us to understand on the science side of things, where are the gaps in our methods? Where are the gaps in the uses of our methods? So that's been going strong. And this year we'll be doing another global HTA roundtable. It will be our second. Last year we did our first and it was very successful. But in addition to that, we're very active in terms of surveilling for guidance and policies where HEOR is involved or relevant. So we do about 10 policy responses a year to healthcare authorities such as FDA, CMS, EMA, and others, where we need to have a voice. It's more about, how is the science being applied in their policies and practices. And by the way, an increasing number of those policies actually cite ISPOR's task force reports. So that's a huge shout out and kudos to our members who are increasingly having their work being taken up and visible by healthcare authorities. And then I'll add a third way, and that is we've stepped up our direct interactions with healthcare policymakers, especially regulators. We have a strong relationship with the European Medicines Agency. We also have a solid relationship with DG Sante of the European Commission. Mm-hmm. We are in the process of negotiating an MOU with World Health Organization Europe as well, which is very exciting. And so those are just examples of things that are happening now. In addition, we are going to be hiring ISPOR's first ever policy director. Mm-hmm. That position will take shape this year. We will hire this year. First on that hire's agenda will be to develop our policy priority list in association with our member leaders and association with our board of directors, because having focus is going to be critical to that individual being successful. And what that's going to allow us to do is to be proactive, so we have to move away from being reactive. So, oh my gosh, CMS has put out a policy on Harper, let's respond. No, we actually have to become proactive and have the relationships available to help shape how HEOR is used in policies. That it's very exciting, and that's the overall direction that we're heading.
So there's always been a really challenging intersection between cost effectiveness and affordability. And I would say in many cases, as researchers, we've probably skirted around that affordability issue, perhaps more than we should have. What is ISPOR doing to take this issue by the horns and implement either uh, approaches, conversation, policies that really address affordability?
So, affordability is in our new strategic plan. I would say it's probably one of the boldest words that ISPOR could have used based on its history. Its history, as you know, has largely been based on cost effectiveness,
Hmm.
which doesn't necessarily doesn't consider affordability per se. It's more about how much outcome are you getting for what you spend,
Hmm.
and that is still the critical piece of evidence that our members and stakeholders are really, focusing on. But yet, we're in a world where healthcare systems worldwide are unsustainable on their current path. There are labor shortages. There are access gaps to innovation
Yeah.
because countries just can't fund some of these kind of new innovations. And so to continue turning a blind eye to affordability is just not going to work for HEOR or evidence generation in general.
Mhm.
Are we saying that ISPOR is going to become the affordability methodology guru, or that's going to become our main emphasis? The answer to that is no. ISPOR is and will remain about healthcare value assessment.
Mhm.
Affordability is the contextual issue. Now, we know that certain healthcare stakeholders, I'm thinking of ICER as one, has attempted to tackle the affordability question by coming out with metrics. How much of a GDP can be afforded on innovation, and how much of that GDP increase will this new treatment that's coming out consume?
Mhm.
Those calculations, have been somewhat kind of, I would call them sort of nascent in their evolution. Would ISPOR have a role to play in understanding those? Yes, I think we do. Do we have a role to play in furthering them? Yes, I think we do. They will, however, not become a part or the main part of ISPOR's focus or kind of the value assessment frontiers, if you will. Um, and I think the reason why we would go there is, like I said, to understand perceptions of affordability. How does a payer define it versus a patient versus an HTA? Just understanding conceptually, when the term is being thrown around, what do people mean when they're saying affordability? I think that's important for ISPOR to understand
Yeah.
because it pertains to as I said, the environment within which all the evidence we're generating is being used. So if you don't understand how the consumer or user of that evidence is applying affordability, how do you know that the evidence is going to resonate with their needs? So that's kind of what this comes down to.
Well, it seems like it also merits increased attention is if ISPOR is simultaneously looking to broaden your scope to a more whole health option. Then one can look at affordability in a greater context as, for example, putting money toward a particular drug treatment versus something that might have benefit far beyond just the measures that we're looking at right now. If ISPOR is engaging in those kinds of bigger budget concerns and policy discussions, then affordability takes on a slightly different flavor as well.
Yes. Yes. I think there's some really interesting scientific questions we can ask about it, though. Like I said, just defining affordability from different perspectives is I think, super interesting, and particularly how patients might define it. We have a robust patient initiative, and I know others have done work on this as well. We're not treading in new territory here entirely, but it's important to understand, how patients are impacted, what kind of trade-offs and decisions they have to make in order to afford their treatments.
And the value argument does not work in those situations, and that's important, I think. But the traditional value argument.
A different kind of value argument for them. They tend to be more interested in health benefits, and what those benefits, what relevant benefits are to them.
Looking at how organizations are now being set up, certainly in the biopharma space, market access is an increasingly important division. Medical affairs has taken on a greater focus as well. But HEOR, speaking specifically about market access, HEOR and market access have had an intersectional relationship for decades. But now, with market access truly its own entity, with its own training programs and leadership and associations, there's a bit of a division. Tell me a little bit about ISPOR's perspective on that. And I'm thinking particularly about operational efficiency for HEOR, what's going to stay in that space, what's clearly over in market access. How is ISPOR serving your members to try to serve everybody or not everybody? What are you thinking?
Yeah. Well, first of all, access topics have long been a part of what ISPOR supports and basically showcases through our content and science and policy initiatives. So access is not new territory for us. We already have a global access to medical innovation special interest group, just as one example. I think what's been interesting are the shifts that are happening primarily in the pharmaceutical and biotech industry, where standalone HEOR groups or value and evidence groups are being or were disbanded and sort of decentralized into different departments or put under one, like market access or medical affairs. Our impression of this, having done some research, most notably through an industry survey late last year, is that the shifts they're not cutting HEOR. It's more movement of HEOR. In fact, it's because that the science of value measurement is so important, and that that like there's potentially internal competition for ownership of it. Now, in terms of market access as being home, we're very well aware that market access societies are cropping up. We view those societies as collaborators to ISPOR. ISPOR is very much involved in the science of HEOR, which you need the scientifically generated evidence to support access. So clearly HEOR is an important, relevant component of access. So we have friendly relationships. We view the access community as friends of ISPOR. We would love to increase those collaborations. We'd love for more market access professionals to engage with ISPOR. We have a collaboration with the Access Forum, just to give one example that I'm leading. That will involve a partnership where we work with them on a segment for their meeting in Austin in June. And they are visible at our conference in Montreal. And we also have a small work group with them to talk about what are our shared interests and how might we move that forward. I think one area where there's clear interest is understanding, is there a preferred model for access within the industry, and specifically from our point of view, how HEOR fits in access? What parts of access does it address? I know, at least I'm aware of, individual companies are already working on this kind of mapping. I think there's a question about, is there a role for ISPOR to play, or for ISPOR to play with another access group to formally kind of codify that or showcase that through our various levers. That I think would help. I'm not honestly, though, convinced that there is that best model. I think it's highly dependent on the company, the kinds of innovation they have, how big they are, how do they have an access function formally or not? I think there's a whole bunch of considerations that led itself to companies basically figuring out and deciding what model works best for them for access and for HEOR. So I could be wrong about this, but based on what I know so far, I'm not sure that there is like a single best model. There might be a series of best models, functions that we know that HEOR functions can fit in access, or functions with HEOR that fit in meta pairs. So we're working on that. And I think the other clear interest of synergy is in our shared competencies. ISPOR has a HEOR competencies framework that has over 40 individual competencies. It's the knowledge and skills that encompass the HEOR discipline. We recently revalidated that, or I should say we updated it last year. We'll be putting those results on our website probably by May. We're working on that right now. But in a nutshell, part of that work involves segmentation of the HEOR audience. And we did ask, what is your main specialty area? And we had a number of HEOR professionals who responded to that survey. And so we were able to segment out the competencies for market access professionals versus other HEOR specialties. And it was really revealing in that there's a huge amount of overlap between what market access professionals need and what HEOR professionals need in terms of their knowledge and skills.
Yeah. This really is a follow-up to that. There's been some discussion over the years with ISPOR trying to estimate the value of the HEOR function. There's been some presentations. Most of them that I've personally seen are fairly qualitative in nature. Is this an area of focus for ISPOR to really take this bull by the horns and try to do some demonstration work on the value of the HEOR function?
Yeah. Yes. And Patti, you may be referring to some of the sessions that we've had at our conferences. Like they have been standing room only. And yes, they've been somewhat high level. The answer is that there's a variety of different approaches we're taking right now to address this. And yes, it is really important. In fact, part of our new strategic plan is to actually, with this new policy goal, is to elevate the importance of HEOR as a profession. What are we doing? So to answer that, a few things. Number one, we have this program called Amplify, which our marketing and communications department, led by our amazing CMO, Betsy Lane, is spearheading, and it explains HEOR in very easy to understand terms. In fact, the ad campaign is called HEOR Explained. And we have a website for it now. There's been promotions on social media. It very clearly kind of elucidates what's behind this mysterious acronym, HEOR, which a lot of people still don't understand. And so I think that's one big plus. We have an ambassadors program as well that her team is spearheading, where we have HEOR leaders from the ISPOR membership who are interfacing with members of the media and other stakeholders to engage on specific topics where they have expertise. Our education department is working on soft skills, short courses, and programming. Now that's big for us. And this is something that puzzled me, having been a long-term ISPOR member. When I came to ISPOR, our education programming was highly scientific. And of course, I know that we're a scientific society, but we haven't really done a lot of soft skill training, except through, let's say, our new professional network or student network, where they're in early stages of their career. And those parts of ISPOR have been building soft skills. But our education department, with the help of our education council of members, is working now on building out our programming to address some of the soft skills. Now, so there's another probably question here about, all right, so what else? We'll continue to showcase this topic at our meetings. There's a session I'll be participating in Montreal, where we'll talk about what are the skills gaps in HEOR professionals. Not surprisingly, when we've done some reconnaissance on this, we're high in technical abilities. We're solid in those technical skills. But where we need to really address are things like business acumen, understanding the policy environment, understanding the role of different stakeholders, understanding communication and negotiation and advocacy. So
Mhm.
these are things that, as scientists, not all of us have had the opportunity to get either on the job training for or formal training for.
Mhm.
And ISPOR has an important role to play with that, and definitely we are working on that. I think that the last thing I'll mention is maybe more of a niche thing, but it's an opportunity here to build awareness about it. Um, and that is that we have HEOR impact examples as a new type of content submission to our conferences.
Okay.
What these are basically HEOR in action. HEOR that's generated but has some impact that is measured with the decision maker, whether it be an HCA or a policymaker.
Mhm.
And so we're really trying to get great examples of HEOR in action so that we can showcase the value of the field.
That's very encouraging to hear. I know that in some larger pharmaceutical companies, it is an essential component when proposing a particular study, that a present value analysis be conducted of the impact of the study, of the value of the study. What are going to be the sales of the drug with this particular study? What would be the sales of the drug without it? And done in a present value where you're taking into account both the risk, the cost of money, and the duration over time of which that would have an impact. Those are the kinds of things that I think are really, really essential type responsibilities of HEOR leaders within their company. But I don't know that everyone has the capacity to do it. And I certainly don't think that most of us have even the ability to do that. So I think that that kind of education would be really helpful that ISPOR could offer its members. Like, here is a way that you can demonstrate from a department level
Yeah.
your value to your own organization in words, present value, and profit that makes sense to the senior C-suite leadership.
Yeah. And you've hit on something so important with that idea, Patty. It's a great idea. And you're right. I mean, I think we have to get more formal in the measurement of the value of HEOR in a way that appeals to senior leaders. That's something we've also talked a lot about in terms of, we're really good at ISPOR at, getting up to, let's say, the VP level engagement
Yeah.
in HEOR. But we need to work above that. We need to work with senior VPs and executive leadership of biopharma in order to understand, how do they define the value, and what basically we want to make sure that whatever value metric we come up with would resonate with them. And so I think you've raised some good points, but taking it down also at the department level, we've done some exploration into performance metrics for HEOR. Within industry functions. And gone are the days when publishing a paper should be the finish line.
Yeah.
It's more like working internally successfully with the team to get an indication or to get a successful contract negotiation. So I think that we have an important role to play there. And that's an area too, where the market access collaborations can be super helpful. And that's something that's like, pretty easily implemented, in terms of at least recommending what metrics should be used.
Yeah. And to pick up on your suggestion that there are going to be educational opportunities for people to increase their negotiation capabilities, their presentation capabilities, I can see a really great opportunity for those types of programs would appeal to both the Access Forum and to ISPOR, because a lot of those needs happen in that intersectional relationship. When you're passing over the data to those that are going to present it to the customer is really when you need to ensure that those soft skills are being utilized to their highest possible ability.
Yes, absolutely. Absolutely. But also, in the generation of the evidence within the innovator company, communicating interprofessionally with
Mhm.
folks that are on the front lines with the HTA and payers to understand what the needs are of the marketplace and make sure that the evidence is generated to align with those needs.
We talked a little bit earlier about some of the changes in Washington, and this is a one area that I want to make sure that we call out. There certainly has been some tumultuous times around diversity, equity, and inclusion. What is ISPOR's stance on DEI, both as it relates to the ever so important need for diversity and equity and inclusion to be considered in clinical trial recruitment and in health outcomes, but also from a professional standpoint for its members?
Yeah, thanks for that question, Patty. So, ISPOR, as an international organization, is diverse. We must be diverse because there are different needs for healthcare and there's different perceptions of value, uh, depending on where you are. So we have to be geographically diverse as core to what we do. And that means we also have to understand and respect individuals based on their different backgrounds.
Yeah.
I will also say that HEOR itself, of course, is extremely diverse. It's a team sport, where we have different kinds of scientific and policy expertise working together to inform the evidence, and how it's used. And so, diversity is not going anywhere. It is poor. In fact, we are, if anything, we're really kind of improving our diversity, equity, and inclusion efforts. Inclusion is one of our core values in Strategic Plan 2030.
Mhm.
With equity, we have a health equity SIG that's doing some fantastic work. Let's say, one of their projects is examining equity measures in HTA.
Mhm.
So this is going to continue. In fact, it's going to grow, and the reason why is because it's who we are. I mean, diversity is so core to
Mhm.
who ISPOR is, and it's so necessary in order to generate robust evidence that actually is useful to patients and patient access. Now, I will say within that, though, that it may have sounded like I painted a completely rosy picture for you. You know, um, we historically have done better at ISPOR with including the developed parts of the world, such as North America, such as Europe. And, let's be honest, there are parts of the world that have not been as visible or prominent, and they have different HEOR needs, they have different budgets, et cetera, decision making context. Um, and believe me when I tell you, we hear from these different parts of the world, and they want a bigger voice. And so we're working really carefully. This year, specifically with our global member engagement team. I'm going out and hitting the road and meeting with folks in Central Eastern Europe in a few weeks, and then we have some members, some of our leadership also meeting individuals in Asia Pacific. We're in early stages of planning a Middle Eastern summit for 2026. We're really interested in Africa, which is rapidly advancing in terms of their regulatory apparatus and the use of HTA in African nations. We need to improve our diversity in terms of what's historically been underrepresented countries and locations participating in ISPOR. And we're working on that.
And just looking here at home in the United States, it also is a question that I have. How much has ISPOR focused on rural health?
Not a lot. We have some conference content, I would say, that comes in on rural health. But where it, I think, is getting a lot more interesting and relevant to ISPORians is along the lines of access gaps, disparities in the diffusion of treatments and innovation. I also think that with our whole health strategy, that rural locations have different needs than urban locations.
Yeah.
And so I think the time is now for us to really start getting more involved in rural health. I see it increasing. So it's not something that's like, really prominent at the moment, but knowing our long-term direction, I see it increasing in our activity.
I would agree. That's a little bit the reason I brought it up. As you begin to look on a broader policy basis and making arguments, should money be put into education or should money be put into, something else? Then all of those conversations about the who become ever so much more important. Furthermore, with some of the threats on Medicaid that are happening in every state. This is not only a national issue; it's an individual state issue, and I'd be curious if whether or not for a future conference, if maybe there was an opportunity for some of these states to showcase some of the impact of some of these policy changes on their direct Medicaid and rural population or underserved populations.
Yeah, yeah. It's such a great idea, and it's such an important frontier for us, like moving ahead. I think in order to achieve that, we need to do a better job at bringing in, I'll call it like the health services research community, who are really expert in understanding the differences in payment policies and demographics, for the rural subset of the population, and inspire them to engage with us. And that's part of what I didn't talk about yet today, which is really expanding our stakeholder reach.
Mhm.
That there's other scientific disciplines who are important stakeholders to HEOR. I think health services research is definitely one. I think implementation science is another.
Mhm.
I think environmental science is another. And
Mhm.
I can go on about that. But in a nutshell, to part of the point that we're making with this whole conversation, if we want to go to rural health, we need to do a better job of bringing in these other stakeholders. So,
Mhm. The last several ISPORs that I've attended, both annual and European, you've had a major or at least a notable focus on artificial intelligence. Uh, Now that some of the initial excitement has worn off about it, there's a small bit of real world experience with AI, with certain applications, and I'm really wondering, uh, what is ISPOR focusing on in terms of 2 to 3 critical issues that you think need to be an area of deeper dive from an ISPOR perspective?
yeah. Okay. So, I would say the first one is figuring out which elements of AI use require human oversight. Maybe it's all, maybe it's some, it's probably all, but at what level?
Mhm.
Um, to that end, we have a task force that will be starting up looking at AI use for systematic lit reviews, just as one example. And it will consider the different steps in the SLR process and what the human oversight requirements are. So human oversight is definitely of high interest to us. I would say that the generation of evidence from large reams of qualitative data, what I like to think of as the bottom of the real world data iceberg,
Mhm.
like actually, I'll call it harvesting that qualitative data for decision grade evidence is a huge, potential frontier for us. How do we use the technology to do what humans have not done well, which is go through reams of information and try to call out what the relevant outcomes are? We have a long way to go before we get to the point where that is a validated technique that meets regulatory and HTA grade decision making. But I think that's going to be an inevitable part of our future, an important part of our future.
Mhm.
And think about the power. Think about the power of what we could do if we start taking SOAP notes, let's say from an EHR, and we're able to pull out really rich qualitative information into objective outcome measures or indicators. So there's just so much promise there. So we're really interested in that. Um, in addition to that, of course, is how AI is used in policies. I can start by saying our own policies. ISPOR is a huge purveyor of content, scientific content. We have an AI policy. We've had to change it a couple of times already, just in the past year, to account for the expanded uses of AI. We're allowing for AI use, but we're asking for it to be disclosed.
Submissions?
Pardon? Conference
When-
submissions and in submissions to our journals as well. Now, I think the other part of this is how AI is included in policies from the regulatory and HTA authorities. So far, that's only just starting to percolate. We know that NICE has a very robust statement on AI use in HTA. There's going to be more formal kind of guidance coming from them than from other healthcare decision makers, no doubt. And we just need to make sure that HER is included in those policies, but moreover that there's appropriate use of the methods and oversight. So those are probably the three priority areas now. In terms of its uses, though, I mean, we are very well aware of it being used across the whole spectrum of HER. From study design to writing code, to model development, to structuring, to writing study reports. We know these things are happening. And so, it's right now sort of a matter of deciding where's the biggest opportunity scientifically, and also where is the greatest need, and how can we shape the human oversight and policies to support it.
We're now ready for our rapid fire round, my favorite. So these are going to be questions that I would love for you to answer with just a few words, and just tell us what's on the top of your head. If there were no constraints on your time, money, or staff, what big issue in healthcare would you want ISPOR to solve?
Patient centricity. Of course, we use that word. We say we're patient centric. We have great patient centered initiatives, but the system is not built around patient centricity. And I don't know how much of our audience is aware, but I shared my own journey, with having autoimmune disease at our Global Patient Summit last year. It's a passion of mine, and I think we have a lot of work to do to become patient centric.
What keeps you up at night?
Not much. I sleep like a rock. That's not that I don't worry. It's not that I don't worry about the world. I worry about uncertainties. I worry about divisiveness. But remember, a big part of my day job is actually bringing people together and overcoming some of that divisiveness. So I kind of go to sleep with a level of peace somehow, knowing that I did as much as I can in that particular day to combat some of these world woes.
Very encouraging. And if we're having this conversation again in 10 years, what do you think we'll be talking about?
I think there'll probably be a drone dropping my medication off at the front door. And we'll be doing HEOR assessments for less than 30 minutes because we'll have prompts and tools at our fingertips. I think there'll still have to be significant oversight and shaping of that from humans. What else? I think we'll still have some of the challenges that have long plagued our healthcare system knocking at our door, like financial sustainability, access gaps. It's not to say that we will make strides on those things, but those are complex global challenges.
Yeah.
So those are a few things that I see.
I'll throw one in that I think is particularly exciting. It's being examined at the Mayo here in Jacksonville. Hospital at home. Yeah, they've got a full system that they're testing with cardiac patients, where they release the patient almost immediately, and then they have pods of all of the hospital required tools on the call, on the ready to get to the home within less than 5 minutes. They also have robots in the home, sleep monitors that can tell if the patient's heart rate is changing, all of those things, and immediately dials up an on-call nurse to fully assess and activate. So wow. I find that really, really exciting.
It's really exciting when you think about the access implications and potentially the, long-term cost implications.
Yeah.
Where the startup costs are quite high. And I have visited that campus in Jacksonville. It's really impressive. So it's great to hear that they're forging ahead with this work. One thing that I didn't mention is digital twins. We're creating such enormous footprints of our digital data. I know folks are already talking about digital twins and their use in research, but given the costing and complexity of implementing clinical trials, I feel like the system is going to push us more towards these digital twinning and you kind of like digital footprints of ourselves, which will become, I'll call it the future subjects of research. Won't be us in the flesh. It'll be our digital footprint.
I don't think I understand that. I'm not familiar with it. Could you tell me a little more?
Sure. I mean, the idea is that we basically there's so much data that are being created by us just in our daily lives through our cell phones, through any wearables that we have that might be collecting healthcare data, through our interactions with the healthcare system, through our purchasing behaviors, what kinds of food we're buying, through our education achievements, through any other number of types of data that are just generally being collected through our existence. That the idea behind a digital twin is that we could project how well or who might be most likely to benefit from a treatment or how well it might work based on our digital makeup
Oh,
of ourselves.
mhm.
Maybe
Fascinating.
the subject of a future podcast.
All right, complete this sentence for me. I am optimistic about.
I'm optimistic about the world. I know we live in a world that feels very what's the word oppressive. I do believe that people are good, and I do believe that people, when they band together, can do great things. It may not be at the government level. It may be in their community. It may be with their family. It may be through ISPOR. And I think now more than ever, we need to band together and really try to make some strides to improve the experience of others. So I do feel good about humanity. I feel good about the world and about people, but it's because I know the power of individuals and that we all have. And I hope that doesn't sound too corny, but I live that every day through ISPOR. I mean, because we're able to take people from diverse parts of the world or with perspectives that don't always agree, and are able to produce great task force reports or special interest group projects or conversations on the stage. So I know it's possible. And I think we just discount the impact that we have as individuals.
Mhm. I concur with that wholeheartedly. I have noticed in the past 6 weeks so much activation at the small group level, and some of the initial conversation is, if we don't do it, no one's going to do it. And so I think then in some ways that is an unintended positive consequence of some of the chaos that we're feeling that is happening around us. So
True. Yeah.
let's hope that our positive perspective really does come true and continues to be activated that way.
For sure.
I deeply believe in what?
The need to diversify ourselves beyond the world we're exposed to.
Mm.
I think it's overwhelming in terms of, not just the news, which we sort of been alluding to here, but just the pervasiveness of technology in our lives. And I feel as though we're at risk for losing some of our creativity. And sometimes we just need to unplug, take a break, get out there, draw, garden, craft, sing, listen to music, watch a movie, do something other than stick to our screen.
Yeah, yeah, and to our known group. maybe that's an opportunity for ISPOR to create some sort of cross-country, cross-cultural collaborations with attendees at meetings. I know that when I go to the meetings, I certainly see clients and I certainly see old friends, but I'm a little less good, particularly at this stage of life, of really, really throwing myself into a completely un uh, a completely new situation. So I could see a lot like the women HEOR roundtables, where you go together with a group of women to increase your network. I might see something that is, putting together someone from Peru with Japan, with Zimbabwe,
Yeah,
with
that's
Alabama.
that's a great idea. Great food for thought.
Mhm.
Uh, we've done things like we brought meditation into our conferences. We're very successfully. We're thinking about doing like fitness challenges as well now. I mean, a lot of conferences are doing this, but the idea is to kind of take us away from the grind of the screen and these really intense conversations, and just give ourselves a little bit of a break.
Yeah, yeah. Last, complete this sentence. I'm binge watching what?
I'm a little behind for the season, but I'm binge watching Only Murders in the Building on.
Oh,
I just love this unlikely trio of Selena Gomez with Martin Short and Steve Martin. I think the intergenerational complexities between them, and just the dialogue and the writing it gives me good belly laughs. So yeah, I think I'm in episode 6 now, so I'm almost done with this season. But I have thoroughly enjoyed every season so far.
what a great choice. That is a really good decompression binge. Well, we are concluded with our interview, Laura. I want to thank you so much. Your insights, your willingness to put some of your personal views out there, including giving us a real peek behind the curtain, a transparent curtain of ISPOR, of what the organization is focusing on. I can tell you that I'm probably more optimistic about the association than I have been in a really long time. I've always been such a supporter of ISPOR. But to see that it continuing to evolve in what I consider really socially relevant ways is incredibly encouraging to me.
Well, thank you, Patty. Thanks so much for your time today too. And I hope you stay engaged with us. And we appreciate the opportunity to showcase what's going on behind the scenes. And I hope a lot of your viewers out there want to engage with us too.
I hope so too. Thank you, Laura. You have
Thanks, Patty. Take care.